Here's where it gets strange. You're lying on the floor of a mud brick house in ancient Egypt. It's 1550 BC. The sun is hammering through a small window. Your left arm won't move. Your face feels wrong. One side of it has simply stopped working, like someone cut the rope attached to it. You're trying to speak. The sounds coming out don't match the words forming in your head. Your family is terrified. They have no idea what is happening to you. Neither does anyone else on Earth. The physician arrives. He examines you carefully. He checks your eyes. He checks your limbs. He takes your pulse with 2 fingers pressed to your wrist. He has seen this before. Not often, but he has seen it. He has a name for it. He has a treatment for it. And some of what he does next, 4,000 years before the invention of the CT scanner, will turn out to be correct. That's either remarkable or deeply unsettling, depending on how much you trust modern medicine's assumption that it invented most of what it knows. Let's find out which. Part 1. The oldest description of a stroke ever found. The year is 1862. You are in Luxor, Egypt. An American Egyptologist named Edwin Smith is examining a papyrus scroll he has just purchased from an antiquities dealer on the banks of the Nile. The scroll is old, extraordinarily old. Smith doesn't yet know exactly how old. He unrolls it carefully. It is 17 meters long. Written in hieratic script, covering 48 case studies of medical conditions observed and treated by Egyptian physicians. Smith spends years trying to decipher it. He dies before he finishes. The scroll sits in the New York Historical Society for decades, largely ignored. Then something happened. In 1930, an Egyptologist named James Henry Breasted finally publishes a full translation, and buried inside Case 46 is a description that stops modern neurologists cold when they eventually read it. The text describes a patient who has suddenly lost the ability to move one side of their body, who cannot speak properly, whose face has drooped on one side, whose consciousness is altered but present. The Egyptian physician writing in approximately 1600 BC doesn't call it a stroke. He calls it a disease of the brain, and he notes, with the particular clinical detachment of someone who has seen too many cases end the same way, that it is an ailment not to be treated. He wasn't being callous, he was being honest. But here's where it gets strange. He knew it came from the brain, not the heart, not the liver, not the blood, not an evil spirit entering through the ear, the brain. At a time when most civilizations attributed disease to supernatural causes, Egyptian physicians had already connected sudden one-sided paralysis to a specific organ inside the skull. How did they know? That question has never been fully answered. Part 2. What they called it. The year is 400 BC. You are in a courtyard in ancient Greece. A physician named Hippocrates is sitting with a student, describing something he has observed in patients across decades of practice. A sudden violent event, an abrupt loss of movement, a face that falls. A voice that disappears mid-sentence. He gives it a name, apoplexy, from the Greek word apoplesein, to strike down suddenly, to be struck as if by a blow from an invisible hand. Of course he chose a violent word for it. It is a violent thing to witness. An invisible force arrives without warning and dismantles a person in seconds. A Greek physician with no knowledge of blood vessels or cerebral hemorrhage watching a healthy man collapse mid-conversation would absolutely reach for the language of sudden violent attack. Of course he did. But Hippocrates goes further than naming it. He documents it, systematically. He notes that it strikes men more than women. He notes that it is more common in middle and older age. He notes that very severe cases are fatal, that moderate cases sometimes improve, that those who survive the first hours have a better chance of surviving the week. He is not wrong about any of this. A physician in 400 BC, working with no imaging technology, no understanding of blood chemistry, no knowledge of what an artery even does, has produced a clinical profile of stroke that matches modern epidemiological data with unsettling accuracy. Hippocrates also noted something that would take modern science nearly 2,000 years to confirm. He observed that damage to one side of the head seemed to affect the opposite side of the body. Left side of the head, right side of the body stops working, right side of the head, left side of the body affected. He couldn't explain it, he just wrote down what he saw. Decade after decade, case after case. It would not be formally confirmed by neuroscience until the work of Paul Broca in 1861, 2,400 years later. That isn't remarkable. That is something else entirely, and we don't have a clean word for it yet, but the next civilization's approach to stroke was stranger still. Part 3. The treatments that shouldn't have worked. The year is 200 BC. You are inside a physician's consultation room in ancient China. The air smells of dried herbs and burning moxa. A patient sits before a physician who is pressing fingers along specific points on the patient's arm, mapping invisible pathways through the body that Western medicine will not acknowledge for another 2,000 years. The patient arrived 3 days ago. Sudden collapse, one-sided weakness, slurred speech. The Chinese physician calls it zhong feng, wind strike. The belief is that pathological wind has entered the body and disrupted the flow of qi through its channels. This sounds like mythology. Then something happened. In 2016, a research team at the University of Hong Kong conducted a systematic review published in the journal Stroke, analyzing the outcomes of acupuncture as an adjunct treatment for stroke recovery. The review found measurable improvements in motor function, speech recovery, and activities of daily living in stroke patients receiving acupuncture alongside standard care compared to standard care alone. The mechanism is still debated. The effect in multiple studies is real. Physicians working from a framework of invisible wind channels in 200 BC were producing outcomes that a 2016 peer-reviewed journal found worth publishing. That is either the most impressive case of accidentally being right in medical history, or evidence that they understood something about the body's electrical and circulatory systems that their conceptual framework simply couldn't express in modern terms. We haven't decided which yet. And honestly, that might be the most uncomfortable thought in this entire video, because it means ancient medicine may have been doing things that worked for reasons the ancient practitioners couldn't explain, and modern science has only partially caught up to explaining why. But the most bizarre treatment for stroke in the ancient world didn't come from China, it came from Rome. Part 4. What ancient Rome did about it. The year is 150 CE. You are in a Roman treatment facility in the city of Pergamon in modern-day Turkey. A physician named Galen is examining a patient who arrived this morning. Former soldier, approximately 50 years old, collapsed during a meal, right-sided weakness, confusion, difficulty finding words. Galen has written extensively about apoplexy, more than any physician before him. He believes it originates in the brain and is caused by an obstruction of the animal spirits. Pneuma, the vital force that animates the body. He is wrong about pneuma. He is not wrong about obstruction. In a hemorrhagic stroke, a blood vessel in the brain ruptures and bleeds. In an ischemic stroke, a vessel is blocked and brain tissue is deprived of oxygen. Both involve a physical obstruction of flow through the brain's vascular system. Galen describes obstruction of flow through the brain. He has the right word for the wrong reason, which in medicine is sometimes enough to send you in the right direction. His treatments are where it gets complicated. Bloodletting, dietary restriction, herbal compounds including hellebore, a plant with genuine cardiovascular effects that modern pharmacology has studied with interest. Cold baths, massage of the paralyzed limbs. Some of these are useless. Some are actively harmful. The bloodletting was at best neutral. The hellebore in the wrong dose was lethal. But the massage of paralyzed limbs as a treatment for stroke recovery. A 2019 meta-analysis published in Clinical Rehabilitation reviewed 23 randomized controlled trials of massage therapy in stroke rehabilitation patients. It found significant improvements in anxiety, pain, and physiological measures including blood pressure and heart rate. Galen was recommending this in 150 CE, not because he understood neuroplasticity or the role of sensory stimulation in motor recovery, but because he watched patients and noticed that the ones who received physical manipulation of their paralyzed limbs did better. He wrote it down. And for 1,000 years after his death, his writings were the most authoritative medical texts in the Western world, which means his observations about stroke recovery, some of them correct, some of them dangerously wrong, shaped how physicians treated stroke patients for over a millennium. The correct observations survived because they worked. The dangerous ones survived because nobody was running clinical trials. But there is one more piece of this story that modern medicine doesn't like to talk about. Part 5. What ancient humans understood about prevention. The year is 2021. You are in a research facility at University College London. A team led by epidemiologist Metin Avkiran has just finished analyzing cardiovascular risk data from archaeological remains across multiple ancient populations. Skeletal markers, arterial calcification detected through CT scans of mummies, dietary reconstruction from isotope analysis of ancient bones. The finding is published quietly. It does not make global news. It should. Ancient hunter-gatherer populations showed dramatically lower rates of arterial calcification than ancient agricultural populations. Ancient agricultural populations show lower rates than industrialized ones. The progression is linear. The more a population resembles modern industrial life, the more their arteries show the preconditions for stroke. Constant movement, diverse unprocessed diet, no chronic psychological stress with no resolution, no seed oils, no refined sugar, sleep governed by natural light. These are not ancient health trends. These are the conditions under which the human cardiovascular system was designed to operate. The Semen people of Bolivia, studied by researchers at the University of New Mexico and published in The Lancet in 2017, show the lowest rates of coronary artery disease ever recorded in any population studied. They are a semi-hunter-gatherer group living in ways that approximate pre-agricultural human life. They are not immune to stroke, but they are extraordinarily resistant to the vascular conditions that cause most strokes in the modern world. They are not doing anything radical. They are doing what humans did for 300,000 years before civilization made it inconvenient. And here's where it gets uncomfortable. The ancient Egyptians, who correctly identified stroke as a brain disease in 1550 BC, lived in a society that was already more sedentary, already more hierarchical, already more removed from the ancestral conditions of human health than the hunter-gatherers who preceded them. The Egyptians were already downstream of the problem, and so was every civilization that came after, including this one, CLOSEN. Nobody in 1550 BC Egypt knew what a neuron was. Nobody in ancient Greece had seen a CT scan. Nobody in Han Dynasty China had run a randomized controlled trial. And yet, they named it. They documented it. They connected it to the brain. They noticed which side of the head affected which side of the body. They developed physical therapies for recovery that modern rehabilitation science has validated. They identified risk factors that modern epidemiology has confirmed. They built medical systems around treating something they could not see and could not fully explain. And then they passed that knowledge down, imperfectly, through texts that got burned and scrolls that got lost and translations that introduced errors that persisted for centuries. Some of what they knew was wrong, dangerously wrong. Some of it was correct in ways that modern science is only now formally proving. And some of it, the deepest parts of what the most careful ancient observers wrote down, remains neither confirmed nor refuted, just sitting there, in text that most people never read, waiting. The Edwin Smith Papyrus is currently housed at the New York Academy of Medicine. It is not on display to the public. It has not been fully acted on by modern medicine. The Egyptian physician who wrote Case 46, who correctly identified stroke as a brain disease 4,000 years ago and declared it untreatable, was not entirely wrong about that last part either. Stroke remains the second leading cause of death globally. Somewhere in your body, right now, blood is moving through vessels in your brain at a pressure your ancient ancestors never experienced, sustained by a diet they would not recognize, stressed by conditions they could not have imagined. The physician in 1550 BC who pressed his fingers to a patient's wrist and felt the pulse moving through it was feeling the same thing you are feeling right now if you press two fingers to the inside of your own wrist. The same blood, the same pressure, the same fragile system. He knew it could fail suddenly. He just didn't know why. We know why. We're still not sure what to do about it.